Hello, everyone. Um, Welcome back to Life with Pam again. And yeah, so I hope everybody can hear me. Can we have any comments and see anybody? Yep. Can you all hear me? And please, if y'all can, just let me know. And then please do the like and share. And we will let you know. And stay tuned to the end. Then we will announce the winner. All right? So, yes, thank you. Hi, everybody. Okay, so please like and share. Yep, yep. Thank you, Josh. I hope I pronounced your name properly. Yes, Johin Taimin. Yep, thank you so much for the response. Thank you, Macy. Yeah, um, I am really happy that it's a Saturday night and you are here. You're here joining us with for this, and we are going to share and talk about the oral hygiene of your child, okay, and what are the practices for the oral hygiene. So before we start, I just have to let you all know once again that we can you're encouraged to try out our new Medela flags, new Medela freestyle flags at our Medela Service Center in both KL and Penang. So and it's only open to those who contact us and schedule for an appointment. We will not encourage anybody to walk in because we will not know, like because of the social distancing and stuff like that. So we are very, it's really closed. It's a closed door event in a way. It's a closed door. So and it's personalized to just you yourself. So you are able to try the palm for yourself and the touch and feel, of course. All right. So please do contact us to book a slot in the service center in both KL and Penang. Okay, so once again, we are having Dr. Caryn, who will be sharing with us how to maintain a good oral hygiene for your child. And yeah, so next is, please, we are having three winners. We'll be having three Q&A and three like and share winners. So the like and share will only be given to those mothers who stayed all the way to the end of the show. Then we will give the like and share. All right. And please, if you are one of the winners, do contact us. And then we will have Q&A from Dr. Caryn herself too. So please stay tuned so that you will be able to answer the questions, and it's fastest finger first. Okay, the first person who answered the question correctly will be able to win yourself the prize. All right, so next, the promotion for freestyle flags on our Medela Shopee Malaysia flag Medela Shopee Malaysia, yes, store is going at ringgit 1399 ringgit. All right. So, and today we are also having the promo code extra 5% promo code store wide on Shopee Medela Shopee store. All right, and it's key down below here. Okay. So, and also if you have any questions, do feel free to just send us a message. So we will be able to answer any questions that you have. All right, so let's not wait and invite Dr. Caryn up screen now.
Hi. Hi,
Hi, Dr.
everyone.
Caryn.
Hi,
Hello.
Medela. Nice to see you again.
Yes, on a Saturday night.
Yes, it was
And I'm
Saturday night
very,
again.
yes. And I really appreciate the fact that there are so many viewers and so many mothers that is on the live show together with us. Yeah.
Correct. On the Saturday weekend that we are not going out, right?
Yes, correct.
Mm.
So,
Okay. So today are we going to start now?
yes, I think we will be able to start now.
Okay. So we will share our slides first.
Mm-hmm.
Okay. So here you go. Okay. So we are going to talk about baby oral care. So the few things that we're going to talk about is we're going to talk about how to take care of the baby oral care from the day that they are born and the day after they're born, and then when they are 6 months old, when they are teething time, and later on when they start having their teeth, and we are going to brush them well. Okay.
So which means this is not only for babies, it's actually for children from the age newborn all the way to maybe 10,
Okay.
9, 10 years old.
9, 10 years old, correct? Until we change all our
Mm,
permanent teeth, so it's including all the children. That means babies to
yeah.
toddler to children. So, Pam, can you see me? Can you see my
Yes, I
slides?
can. Slides not yet.
Okay, never mind. So we wait for the slides to come. So there are a few things that we're going to talk about when the baby is born on the first day of life. When the baby is born on the first day of life, we do latch our baby, right? And after latching, we will have to wipe their gum pads using either the what you call this, the 100% cotton, 100% cotton cloth, which is like this. Okay, the burp cloth. Okay, all right. Otherwise, we can have the gauze, where the doctor's extraction gauze, where we sterile it all the time. So what you can do is you open them up, and we will wrap around our fingers. Okay, there you go. And then you get a water, you get to dip it in, and there you go. You can brush them, wipe them. Okay, so this is one. Another one, you have all the sterile packaging, pre-sterile packaging when you open up. It has to be 100% pure water and no other ingredients. Don't add vitamin C's and things like that. So you can see that the paper is very hard to tear. You cannot tear them. Okay, even if it's teared, it's not okay. So what
Yeah,
you
it doesn't
do,
fray, so it doesn't go into the,
correct.
yeah.
So the baby don't swallow the brush. So you can just
Mm.
okay. Later I show you my baby. I go and take my baby. I'm going to show you how we clean the baby brush, baby's gum pad. So what happens if we do not clean the baby gum pad? When I show you again, let's see whether you can see. So the condition of the baby oral hygiene will be very bad, especially when they have oral thrush, which is the white lesion around the tongue. So this oral thrush will cause the baby to have pain, ulceration, and the baby will not able to latch, will not able to drink well. So this is the white lesion that we do not want to have. And then after that, other than the white lesion, what we're going to have is the saliva rash. Saliva rash is where we get it around the mouth when you have little red dots. Okay, share again. Okay, see, it's not the white lesion, it's like this, right? You get all the whitish spots. Okay, and then the next one you can see is the red lesion, the saliva rash. All right, so the saliva rash, you will okay, I'll show you again. This is the white lesion. The white lesion is all around the tongue. I will show you that is there in my baby as well. The red rashes is because of saliva rash. The baby drew saliva, and as this thing will happen when they are start to teething. Okay, so we have to make sure that we clean the baby's mouth well and clean the oral hygiene, clean the oral cavity, clean the mouth so that we avoid all these lesions to happen. So this is my eldest one when she having her saliva rash. So we seen doctors. The doctors couldn't really help due to the saliva rash around. Okay, so what we do, we just have to maintain clean water and just some face ointment to help all the baby to relieve the pain, the itchiness. Okay, so just now we talk about we go back to what we recap. We use the cotton gauze, we have the handkerchief, and we have the oral wipes. So from here, I show you how we are going to clean the baby by using that. So the first one, it has to be cotton gauze. Okay, nothing, no other things, just cotton and plain water. All right, the next one we're going to have is the handkerchief. Same, we are going to dip them into the water, and then we're going to wipe them. And the last one, when you are traveling, when you're not in the house, where having a sterile and clean water is not easy, we will use the wipes. Okay, so let me go back and show you how am I going to clean the baby. Stop sharing. Okay, so to get it simple, I use the wipes. Okay, see, the baby is awake. Okay, I hope everyone can see the baby. This is my baby. Hi, Sanya. Hi, Poppy. So you can see she's not able to open her mouth. She's not opening her mouth yet. So what you do is you just have to tap, 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 and you can see she start opening. Okay, so once she start opening, you're gonna go in, go across the tongue, and reach to another side. Then you turn it upwards, wipe the gum palate. Okay, and then you just use another side of the cloth, you just wipe it off. And then you're done. There you go. Is it clear? Pam, can you see that?
Yep, but I think we would. Can you please do it again? Because now you are like full screen, so bigger. So sorry,
Cloth, okay? We use cloth handkerchief to that.
Okay.
So we just fold it up, dip them into water. It has to be boiled, cool water or even warm water. Okay, so there we go. Go in, wipe the tongue. Okay, and then there you go. Clear?
Okay. I mean, for me, I think it is pretty clear.
It's clear enough.
But how deep can we go into the baby's mouth?
Okay, so the baby reflex, what you call that, the oral reflex, the gagging reflex is there at the anterior, that means the front 1/3 of the tongue. That means you won't go into the middle or the last part. The baby will gag and baby will tell you that you go in too deep. So you will not worry that you go in too deep, that you go straight into the throat. Because the baby gagging reflex is right at the tip of the tongue. So whenever they eat or anything, sometimes they just gagging. It's actually a safety zone. As they grow older, the gagging reflex go backwards and backwards until become like our adults. It goes far back at the tongue.
Okay. So which means if the white part, sometimes the oral thrush is a bit far inside. So if we can't reach, we just leave it, right?
Yeah. Oh, correct. If you can see, she has the oral thrush. She has the not oral thrush, the white teeth lesion there. Right? She's so good. She opened her mouth. You can see the white teeth there.
Yeah.
Okay, so for the babies, last week we are talking about how the breastfeeding affect the facial muscle. The next thing we are going to talk about is when the baby is starting to have teething. When she's having teething, about 3 months to 6 months, she will start to chew her finger. You will start to have to give them some teether. So the teether, you always freeze it inside the fridge. Okay, and then after that, you will give it to them. Okay, so it's actually numb the whole entire gum pad so that she will be relieved. And when they are starting to eat, we try not to give bland boiled porridge, because when you use the rice and then you boil it, so it becomes too soft, the baby just swallow, right? So we do not help the baby to move and energize and exercise the muscle. So some of the doctors, we do take rice, we add hot water, and then we blend it so that the baby has to exercise her muscle to eat. All right. Another one is, you can, if your baby start to have apple or start by 8 months or 9, 10 months old, we are starting to give them some apples and cold fruits. You just have to cut them into the hand palm size, and then you let them chew or bite themselves. So this will promote teething. Like for her, she will start to drool saliva whenever she will have teeth coming out. So you just freeze the apple or freeze the orange into the fridge a little while, and then you give it to her. That will relieve everything. Okay. So for the children, when the children will have to start brushing their teeth, when the baby is about 6 months, the two lower incisors start to grow, that's when we are starting to brush their teeth using toothbrush. And you can see all the toothbrush in her hand, all kinds of toothbrush. Maybe, can we show people how you brush your little teeth? Oh, no? Okay, come. You want to choose one? Oh, she says no. All right. So we're going to open another one and see whether she will allow me to brush. For her, we will always start to use non-fluoridated because she will start swallowing. We do not want extra fluoride for the babies to swallow. So when she was as young as about 6 months, I usually just take water, because they are still exclusive breastfeeding, right? Just have water, milk. So I just use brush, and then we soak inside the water, clean it up, and brush it for her. Okay, so for Sarah, when she grows slightly older, you can always give toothpaste, and the toothpaste, it has to be non-fluoridated, and we will choose all kinds of any toothbrush that she likes. So for the toothbrush, when I show the toothbrush, you see the little pink toothbrush. Okay, so we have a toothbrush here. The head of the size of the toothbrush has to be small enough. If it's you can always check on the age. If it's 3 years old, or you can have it at 1 year old, or even you can have it at 6 years old. Okay, so this is the 3 to 6, and this one is at about 1 to 2 years old. Okay, so the thing is, once I open up another one, the toddler toothbrush, is the head is always smaller, so it's easier for the baby to reach where we want to reach at the far back of our mouth. So you can see the brush head is supposed to be smaller as compared to this one. You see, it's so small. Okay? All right. So once the head is smaller, we can reach very far back. So it doesn't hurt the baby as much as we try to save, and then we can work as quick as possible. Okay? So you have the round cylinder one. You see the round one on your hand here? Okay, this is the round one. Or either you can have all the grips. You can feel all the grips. So it's easier for them to hold. It has some movement. Okay, so you can train their sensory movement as well. So this is how it is. So same, you're going to use this. You're going to dip into the toothpaste or even the toothpaste or water as you wish. Okay, see, it's strawberry. Toothpaste, any toothpaste will do, and toothbrush we just have to use something that is soft and as long as the head size is small enough. It's not necessary for us to follow the age group, but as long as you find that the baby is comfortable with the toothbrush, then we still start and go ahead with it. So we're gonna start brushing the little teeth. Oh, can I start little brush little teeth? Oops. Yeah. Oops. Hey. You don't like? Okay. Okay, come. Okay. So how about your little flamingo? Oh, she's so fierce today. You say hi to everyone. Okay.
Hello.
Hi.
Can you show me how you brush your teeth? Pretty nice smile. Can we have a nice smile from you?
No. Okay.
No.
Alright. Alright, we try again later when she's more comfortable. We see how whether she can help us with it. But another thing that babies nowadays that a lot of mother will ask is about their snacking time. So a lot of parents will talk about dental caries, and this is what we will read about. There you go. You're gonna start brushing your teeth. So whenever they start to have their food, they like to eat something sweet, something biscuits, bread, and then they do not like to have their proper meals, and that cause a lot of trouble for us. And when they grow as older, start to have sweets, candy, lollipops, and ice creams. So there are few things that we want to bear in mind, that we try to keep them as correct timing. That means if we breakfast, it's breakfast time, and then during from let's say 10 to 12, we are not going to give them any snacks time. Okay, once they are hungry enough, they will have their lunch. Once the lunch is there, they will start eating. Again, no snack, no sweets, no candy, during no bread, no biscuits during the time, up to let's say 3 o'clock. And when 3 o'clock starts, you can always set your snack time, where all the babies or the children can have all the candies they want, all the ice cream, all the fruit juice, anything that they want during the period of time, let's say 2 hours, 3 to 5. So it's a happy hour time for the babies or the children. So when 5 o'clock reach, okay, stop everything. It's time to clean up and brush. Then they can have their nap and things like that, correct? So it's easier for us to control. So it's not that the dentists do not allow children to have candy, but the whole entire idea is to limit the acid inside our oral cavity, to reduce down the dental caries. And then baby gonna brush the teeth. No, baby don't allow. Okay, mommy gonna brush. Come on, let's brush. Oh, alright. Okay, let me see your little brush. Okay, now you brush yourself. Okay, so as long as the baby has the habit of holding the toothbrush, which is a good thing, so parents supposed to assist and help them out until when? Until at least 9 years old, when they fully understand that their teeth has to be brushed. So sometimes even my baby will cranky like this, okay? And what you do is you just have to continue with it, and then we will have to maybe in a way force it. Okay? So let her cool down a little while we'll see whether how we can actually start brushing for her, okay? And because our baby permanent teeth, the first molar grow at about 6 years old, and the two front teeth at 6 years old. So imagine 6 years old baby going to have children going to have their tooth grown, and that will last them a whole life until 80, 90. So The first teeth that usually we see that have caries or decay or even loss of it will be at first molar, and that's what our problem. Okay, so this is what we are having. Okay. She allowed me to brush now. Come on. Never brush. Hello, little puppy. Come on, mommy, brush teeth. Huh? Okay, so you can always have to brush to the back. Okay, you have to brush far at the back. Okay, you have to twist it upwards and brush on the upper gum. Okay, there you go. Good job, baby. Okay, so that's why it's important because she's still very small. She cannot learn how to speak. Even a 3 years old baby, the 3 years old children, they cannot speak everything out. So to me, it's very important for us to have non-fluoridated, because Malaysia and Singapore, we do have a lot of fluoride. Not a lot, controlled fluoride in our water system, and that will help our community to reduce down the dental caries. So hopefully in future we will have free dental caries society, so the dentist do not need to drill them a lot. So imagine if the baby having 2 years old, you have to start drilling their teeth because of dental caries, that it will be a nightmare for all parents. Okay, so as long as she hold any toothbrush she wants, you can have another toothbrush by your side, so she don't grab this. Okay, and we do have a single finger silicone toothbrush, which I do not have it right now to show you. They are silicone, they are not bristle. So if you say it's bristle, it will be like this, and silicone is a bit round and hard. I find it not as effective to brush even for what you call this, the baby where they are 6 months old. I think it's not very convenient. So I still prefer Bristol, and then you need to change all your brushes about 3 to 6 months. You have to change them. So you can look at the grips. So you have sensories, right? Okay, and then the Bristol head is the age size, the elder it goes, the bigger head it has. So for them, it's better for us to have a small one, and since she's comfortable by holding it, she thinking that it's for fun, so which is a good thing. Okay, so what we worried is about the candy that we face, and hopefully we will have more easier control. So as if the baby do not want to eat, let them be hungry a little more, then you feed it again. So we will follow the three meals time slot like our adults. So breakfast, lunch, dinner, and then her in between snack time. And if the baby children at about 6 years old, when they have their first molar, we can always have what we call this Pitt and Fisher sealant, where we cover up the groove of the molar and we prevent them from dental caries. So the molar is huge, right? So it has a lot of groove. So if you eat nuts and things like that, you stuck inside the groove, and it's very hard for the parents to brush. Already not being cooperative, so it's even difficult for us to brush. So in the dentist, we can always add a layer, so we shallow up the whole entire grooves, so that we can brush them well. So we call it sealant. It's a preventive measurements for all the babies, so that hopefully we will protect the whole first molar until when they are grown old enough. So a lot of times this first molar will spoiled by 7 years old, 8 years old, then that's it, the whole entire oral cavity is gone. First molar is very, very, very important for all of us, for all adults, for all everyone.
Wow, do we change the first molar?
No, we don't. That means you see your baby, you have 20 teeth, right? So the last baby tooth behind of it will grow the first molar, which is at 6 years old.
Okay.
Okay, Sarah, say thank you to everyone. Say bye-bye. Say bye-bye to everyone. We'll continue to talk to other mommy, okay? Say bye-bye. Say kiss, kiss. Bye-bye.
Good night. We'll see you.
I see you. Okay, go. Come on. Go and play. Start there and play. Go. All right, come. We continue our topic. So, if any parents do have any questions about pediatrics dentistry or children's dentistry, you can always ask me, and I'll try to answer all of them. Okay. In children toothpaste fluoride, usually I find myself is having dentist. The doctor asks to switch to 1,000 fluoride. Is it good for him? He's age 5. Okay. If it's children toothpaste, we have a fluoride. Not every day I supposed to be on 1,000 ppm, but we do have something called a tooth mousse, where fluoride therapy is that in either in office or in at home. So if it's tooth mousse, we are supposed to use it. It's just a layer of it's just another paste. Just apply it over the teeth area, in enamel area, to prevent dental caries. So that one do have a lot of fluoride. So I think that would be better, because if children swallow too much of fluoride, it's not as good. So I think tooth mousse is the better solution. So we call it fluoride therapy. So if it's the in-office one, the children will have, like whitening tray like that. You get to put them up into the tray, and then you have a suction. So we literally mask and soak the whole entire oral teeth inside the fluoride gel. So we do have it in office, and we do have it at home. So it's at home, we usually don't use it every single day. You can use it once a week, things like that. So it is flavored. You have vanilla, you have ice cream, you have all kind of flavor, so that the baby is more easy to accept by the babies. So how often do we need to wipe the baby mouth after every feed? Yes, we're supposed to wipe our baby mouth every single feed as much as we could. But I personally, I only wipe them almost once in the morning or once in the night. That's it. Especially when the milk drools down, hits to the neck, then I will always wipe it once together. Okay. Do we need to bring our little ones for a first dental visit? Your dentist, when your babies has to go for the first dental visit, it's supposed to be at 6 months old, when the first teeth has grown. Okay, so what happens is, when the first teeth has grown, you will have to brush. You have to go to the dentist. The dentist will teach you how to maintain. So the first dental visit is not as scary. Usually we just more on talking to the parents, counseling the parents, talk to them how we supposed to maintain their oral hygiene, their snack time. So we do not want the baby to be scared or to be paranoid or even terrified. The baby, once they go, is at 6 years old when they have to pull off their teeth. So that is a nightmare. So we go as a prevention. The dentist will just do a little brushing method, play the babies, let them familiar with the whole entire dental environment. That will help them to understand that there's teeth. Okay, then as for the babies, as long as you wipe them well, you wipe the oral gum pad well, so they grown up to know that the oral cavity is clean. So once it's clean, they will continue to brush them. They like the nice clean feeling of the oral cavity. What age do you need to brush your baby with non-fluoridated toothpaste? For my baby, very tricky question. Non-fluoridated, what age do you need to brush? I usually this is based on my experience by my younger brother. As a sister, we say, you don't waste money lah. When I was young, that time I said, don't waste money, just use adult toothpaste. And that time he was about standard 1, which is 7 years old, 8 years old. And I started to realize that today she will start to have a lot of whitish or brownish teeth until today. Whitish or brownish stains around. So that is called fluorosis, where you see on excessive of fluoride in the enamel. Okay, so to me, how long do you need to use the toothpaste? Up to me, it's 9 years old. At least in Malaysia, I think it's 9 years old. So continue using your baby toothpaste, strawberry until 9 years old. Flossing. Because children, their oral cavity start to grow, their jaw starts to grow. So their teeth is only 20 teeth. So some of them, they do have some little gaps in between. They are not tightly arranged, or even they are tightly arranged, you do have some meat passing by through of them. So a lot of time we do have to floss and clean them up, and it's really not easy. It's really not easy to handle. So there are ways for us to handle the babies by how we're going to, when the baby do not cooperate, how we going to handle them. So number one, you can always wrap them, brush them well. Otherwise, you just, how you wrap your baby? You swaddle wrap your baby. You can always swaddle wrap your baby. Like for Sarah, you can always swaddle her because she's still 2 years old max. You just swaddle her, and then one adult carry her, grab her well, and then you just have to brush. No, and then you just have to work quick enough so that it doesn't hurt them a lot. Actually, it's not painful to them. It's just that they don't like the idea of it. So you just do another couple of times, and they are okay. Usually Sarah is okay with it, but I'm not sure what happened to her today. I think she's on live, so she knows. So she don't agree. So otherwise, usually she's a good baby, I would say. So flossing is very important for all children as well, but using the floss will be difficult. So maybe you can have some water pick or water floss where you spray some water gun like that. So you get to spray around the teeth areas will be easier for the parents. And there are times that we see baby after don't see a baby for children for 6 months, and suddenly it develops so many dental caries, and I got scared. But the children came to the dental clinic 6 months ago with 3 dental caries, and 6 months later, everything burst out. So again, snack time is very important for me. No chocolate, no sweet, no candy. Not that no, but at a period of time which is about 3 to 5. Anytime that the mothers one is convenient for the mothers, 3 to 5 is just my small time for her. Okay, so she don't snack every single day. Later biscuits lah, later next half an hour bread, later next half an hour. So the acidic environment that cause the caries. Okay, and I usually do not I will not give my baby nuts, because any kinds of nuts will stuck to the groove like just now I told you, and it's very difficult to brush. It's no way for us. If you eat nuts stuck at the back, you also feel uncomfortable, and we brush also, we feel very difficult until we use finger to dig it out. Now what more is babies, so I will avoid them. I'll try not to give them. I will definitely not give lah. So all the ice creams, all the biscuits, I will give no nuts. So it's easier for her to maintain. Okay.
So which means until a certain age, if it's possible, just no nuts.
For me, it's no nuts. I will not give baby anything. Because anyway, what will you get in the peanuts? What do you get in almonds? What do you get in cashew nuts? For me, it's not as important. It's not something that is essential for the babies. Okay, and usually in ice cream, all the nuts serve no purpose, right? Might as well you just give a simple ice cream, and the longer the acid inside the mouth that cause the caries, like just now I told you, so you rather give a small little candy than a huge lollipop. Hold it for 3 hours, 4 hours, and just that lollipop, or half an hour. I prefer them having small little candy, 5 minutes or 2 minutes done. Okay, then you move on to next ice cream, move on to Milo, move on to anything else.
Right.
Okay, manual or machine toothbrush, which is better? Okay, usually we will start using manual unless it is what you call this, handicapped patients or handicapped children, special needs children, only we start using the machine one, because it will start circulating by themselves. So the parents supposed to use the normal manual toothbrush and do a circular motion on brushing the teeth. So let's say this is the teeth, right? And you have the gum area, let's say my nail is the teeth. and my nail bed will be the gum. What you have to do is you have to brush on the gum area. So it's a circular motion. So it's round, 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 round. So it's important for us to have a soft bristle, so it's not painful for the babies, and the smaller head for smaller children, and adult one. I mean, as they grow, we use a bigger one. So for me, dental caries happen is because of the parents' fault, and to me, it's not the baby fault, not the children's fault. So Pam, you have four. I think you need to use 1 hour to brush them.
Yeah.
Am I right
One
to
at a
say
time.
correct? Am I right to say that for newborn we have to clean the gum pad as per you demonstrate every feed? Yes, we try to clean as much as we can. Sometimes when we latch and fall asleep, then you skip that once or twice. Otherwise, each and every time it's better to clean the gum pad well. Now my 1 year baby quite persistent with whitish lesion on the tongue. How often do we need to wipe and oral tongue after each feed? Yes, I do. We try to wipe every time. So if it's one time you couldn't get away of it, it's okay. As long as you keep wiping, the whitish will go away. Eventually will slowly go away. So you don't like, oh, very white already, I keep rubbing, keep rubbing. Cannot. Just once or twice. Then after that, the next round. So slowly the whitish lesion will go away. Okay. Um, Finger toothbrush for my 10 years old baby. For my own baby, 10 months old, I already start using toothbrush for them. Okay, I don't use the finger one anymore because the finger one is a silicone, and silicone I find it very a bit dirty because in between the silicone there's space, right? So it's stuck with black color dots, and it
Mold.
is and then the what you call it, the if it's bristle you get many of them, so you can just scrape and round it off. But silicone is actually quite there are a lot of spacing around, so it's not easy lah. I feel it's not as good to use. I personally feel but you can always start with finger toothbrush as long as you feel comfortable with it. But 10 months old baby should have a few more teeth and enough for us to give them a toothbrush to play with it. So their job is to play with toothbrush. Our job is to use the toothbrush to brush it off. Do a second set of teeth grow first and push the baby in all cases. Yeah, except then the first molar will grow right behind the baby tooth, and at the same point of time, the lower two teeth will grow. It will push at normal position is supposed to push the baby tooth upwards, and this one will that's why you can see the baby tooth root will be shorter and shorter, and the crown will just drop off. So this one will push upwards. But in some cases, the baby tooth is here and the adult tooth choose to grow right behind or right in the front, so that retain a long root, and that's why we have to put some injections. We need to pull it off. And that's why I keep saying that we do not want to terrify the baby at the age of 6, because that's time when they need to change their teeth. So we always go and visit a dentist beforehand. Let's say 6 months, and then 1 year, 2 years. So I'm sure your dentist will be happy. Your family dentist will be happy enough that you come often to see them. And what we do in the dental clinic is we do like baby to we have electric toothbrush, right? Our dental chair, we do have it, so we will let the baby play with it. We do have strawberry polishing paste, then we have fluoride, so we will detect any early dental caries or even the white lesions, the white we call it white lesion on the teeth. Just like we're talking about white lesion on the tongue, so the white lesion on the teeth is the indication of early dental caries. Okay, and if it's dental caries, another one is what call it, the when feeding on milk bottle. So we do have a noun. We call it bottle nursing bottle then caries. Nursing bottle caries, where the upper front teeth of the children is all gone, left with the lower teeth. Okay, so what happened was they hold the bottle of milk and they sleep through with it. So the milk stays at the upper, whereas the lower teeth is protected by the tongue. That's why it will not get caries at the lower. And you can see all the babies have, all the blackish and ruin them. So do not give your baby having the habit of having the milk and sleep over it. So what happened to Sarah is maybe I understand that it's not time for her yet. Usually we will give her the milk. She have a probiotic, she have a vitamin C, vitamin supplements, then she have her milk, and then only we brush, and then only we wipe her face, and then we will then let her sleep. So maybe it's not her time yet, I guess, because I haven't prepared her everything. So it becomes a routine for Sarah where every day she will do this thing, her sequence, then she sleeps. So she go to the bed with clean oral hygiene. So after brushing, no more biscuits, no more milk, no more sweet candy. So she can go sleep immediately. So after the teeth drop, just gargle and use gum cotton to press on the gum. Yeah. After the teeth exfoliated, drop off, you just have little bit of bleeding point, and that's very normal. You just have to press it on. If you don't, you can always give the baby some ice cream to cool it down, because cold, right? It will what, clot the blood. So every dental visit, you can always go for ice cream. And ice cream don't give nuts. That's all. You can have strawberry, you can have chocolate, any flavor will do. That makes a baby. That's what childhood for, right? Is formula milk cause more white thrush on the baby times compared to breast milk? No, because you can see just now my baby, she's on exclusive breastfeeding, and she still have her oral thrush. And some baby do not get oral thrush. I mean the white lesion, and some baby do get white lesion. My elder one do not get. My second one have it all the time. Doctor, my 7 months even has two new teeth, but doesn't mean you have to start brushing. Yeah. You have to start brushing. If you do not, when you do not have teeth on the gum pad, you use tissue, cotton, or handkerchief to wipe the gum pad. If the moment you see teeth, that's the time toothbrush. You have to start using toothbrush. And she's still holding the toothbrush. I cannot show you the toothbrush. How frequent should how to visit dentist after 6 months old? You get to go and see a dentist. I mean, parents go and see dentist every 6 months or 1 year, right? Just bring along your baby. So the baby will get to know that the dentist is working on mommy's teeth. Does pacifier really cause their teeth not to grow properly? Okay, this one we talked about last week. Pacifier, I never give a pacifier to any one of them, because for me, if you do not know what you're missing out, it's good, right? Correct? So she do not know what is pacifier, and she do not know, she don't have a problem with it. Okay, she don't allow. Okay, so this, they do have circular is easier for you to hold. I find it nice to hold as well, or you can use it like that. Then you can brush the lower teeth. Okay, once you want to change, it's a bit difficult, you just have to change and brush. And I find my daughter likes to hold the flamingo ones, because it's flamingos, so she gets to hold them. So it do gives a little bit of sensory things to the baby as well. Okay, so there are different kinds of in the market. You can opt for anything that you are comfortable with it. Round, you can have this, as long as you can see that the bristle, the head is smaller as the age grow. Okay, that's all. And just now we haven't finished talking about pacifier, so do not give pacifier to the baby, because they get to suck all the time. And sometimes if they do not have pacifier, they will start having their thumb sucking. Do push the upper front two teeth forward, and it will narrow down the upper palate, upper jaw, and therefore the whole entire palate will become very sharp. So it's like a mouse. So you can see some people will do have a mouse look on the face. That's how it is. So I would say no pacifier at all times. Don't even start to introduce at once. And when the baby start to have something solid, try to give them something to chew on. Otherwise, you think of it, when they start to grow their facial muscle from 0 age to 1.5, let's say, until 2 years old, until their teeth is all fully grown. That's it. I mean, baby teeth all fully done is about 2 years old. All 20 teeth will be erupted. Before that, at least 2 years, imagine the baby eat only milk, porridge, cereal, swallow, 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 swallow. So the baby don't get to chew. So it becomes a very lazy muscles. So you want them to start learning how to chew from the day that breastfeeding, learn how to swallow. So and no, don't use bottle feeding. So the bottle would then drip it down. Use something that make them exercise their facial muscle. And once they start to, you have baby led weaning, right? So have carrots, have something for them to hold, broccoli, you can boil them, then they can just chew. So do not worry about gagging reflex. It's not vomiting. You do not choke your baby. Your baby is just having gagging reflex, which is a safe zone for the babies, where their tongue is right in the front, right, the gagging reflex right in the front. So anything go right in the middle, they will just gag it out. So do not worry about choking hazard. Choking is another issue. 7 years still not grow that day. My daughter grew at about 8 months old. So if your daughter grow later, so you will expect the baby will drop their teeth at later age, and their permanent teeth will come at later. As long as the whole entire oral cavity is like 2 by 2, two central together, then two lateral, then two lowers, then two by two, that would be good enough. Oh.
So sorry, we have to compile all the other questions that we haven't answered, and then because now it's the Q&A time, okay? So we will compile all the other questions. I do see that there are more questions that is coming in. So we will compile them, and then we will slowly we will ask Dr. Caryn to answer them, and then we will post it out in one of the posts. All right. So
Sure, no problem.
yes. All right, so we will compile all the questions. I am very sure that more mothers would have more other questions. So we will compile them. And so now it's a Q&A. So for the first question that we have, can we have the tagline so that everybody will be able to see? So what is the age for babies to start using fluoride toothpaste? So it is according to what Dr. Caryn shared, because we know that different areas, different places will have different recommendation. But according to what Dr. Caryn shared, which is the age that we should start introducing fluoride toothpaste? All right, so let's see who got the correct answer. The first correct answer is from Emily Moe. It's correct at 9 years old. Okay, so congratulations, Emily. So please do send us a private message so that we are able to contact you. Okay. So the next question, the question number 2. Where is my tagline? When should we start using toothbrush for babies? When should we start using toothbrush? Okay, so okay. Yep, correct. So we should start using toothbrush when the first tooth starts erupting from their gum, right? So we have the first correct answer, which is Jane Tan. Please, please, please contact us, yes? And congratulations, Jane Tan. So let's have the last question, which is question number 3. What is the correct brushing motion for the children? So is it up down or left right or circular? All right, so let's see. Anybody? Oh, I hope I saw the first correct one. And the correct answer is actually circular. So let's have, okay, it's Celestial. Please contact us. Okay, so circular motion. So it's the correct answer. Okay, so now we are flashing and we are, okay, so congratulations first to the 3 winners for the Q&A. All right. Then the next one would be our lucky winners for the like and share. Okay, so can we have, yeah.
If you have any question, you can always Facebook me. You can always leave me a message. You can anytime on IG, on Facebook, anytime. Then I will try to answer them.
Yes. Okay, so I think we will compile all the questions and have it all answered, and then we will post it up as a post so that everybody is able to come back to this post to see what are the questions that is asked and what are your concerns. All right, so at least there is somewhere that you are able to go to if you need more questions and answers. All right.
Yes.
So now the like and share winners, we have 3 of them. One is the ZJ Hu, and then Fish E and Ashton Clarence. So thank you.
Thank you, everyone. Congratulations.
PM us to redeem your gift. And yes, thank you, Dr. Caryn. I hope we have most of the questions all answered. So thank you everybody on a Saturday night, giving us so much, of your time. And yes, thank you so much, Dr. Caryn.
Thank you so much, Medela. Yeah. Thank you, everyone.
Yeah. So we will compile. Bye-bye.
Bye, everyone. Kiss. Okay, I see you, everyone.
Okay, I'll see you. So we will compile all the questions. So do just leave us more questions if you have them, and then we will compile and we will just send it out or yes. All right. Okay. So do please message us so that we are able to contact you for all the winners. And thank you so much, people. Thank you so much.
Bye.
I'll see you again. Bye.